Erectile dysfunction, simply put, is unsatisfactory erections. So this, for some men, could be the complete inability to achieve an erection. For some men, it's inability to maintain an erection. Anything that makes a man unsatisfied about his erections is referred to as erectile dysfunction. Erectile dysfunction is very, very common. Some studies would estimate that over 50% of men over the age of 40 suffer some degree of erectile dysfunction, and we certainly see that with each passing decade in life, the prevalence of erectile dysfunction is more common. Interestingly, in the past year, with the COVID pandemic, I've seen patients presenting earlier and earlier complaining of erectile dysfunction, and this highlights the psychosocial components that associate with erectile dysfunction. So to understand causes of erectile dysfunction, I think it's helpful to understand how exactly an erection occurs. Men need to have normal levels of testosterone, low levels of adrenaline, properly functioning brain and spinal cord, as well as the nerves at the bottom of the spinal cord called the peripheral or the pelvic nerves. If all of this goes well, the nerve should release a substance called nitric oxide, which promotes blood flow into the penis, and the connective tissue around the penis should be able to trap the blood until the completion of the sexual event. So a problem at any part in this process, such as low testosterone, stress, performance anxiety, depression, injuries to the brain and the spinal cord, injuries to the pelvic nerves, which are commonly seen in patients who have undergone pelvic surgery or radiation, as well as diabetics, as well as common issues such as cardiovascular or peripheral vascular disease, high blood pressure, high cholesterol, diabetes, as well as connective tissue disorders of the penis, such as Peyronie's disease or a prior penile fracture. These are many of the common causes of erectile dysfunction. Erectile dysfunction is a clinical diagnosis. Most patients will present complaining of some aspect of difficulty with either achieving or maintaining an erection or both. As a physician, we'll start with a thorough history and physical exam, followed by laboratory investigations, which might include an early morning testosterone level, a lipid panel, or a hemoglobin A1C to assess for diabetes. Some patients, particularly those that are not responding to conventional oral medications for erectile dysfunction, may benefit from a penile Doppler ultrasound to assess blood flow within the penis and occasionally nerve conduction studies. In terms of erectile dysfunction prevention, I think patient education is key. Eating a healthy diet, exercising regularly, and avoiding many of the common risk factors that cause erectile dysfunction is key. Much research has been performed looking at reversing tissue damage within the penis and improving blood flow, but unfortunately we do not have an FDA-approved treatment option as of yet to reverse erectile dysfunction. Some of the benefits of seeing an erectile dysfunction specialist is a keen awareness of the disease state. Many of us have completed a fellowship, which is a dedicated training after our general urology training. Therefore, we are aware of all of the treatment options for erectile dysfunction, including preventative treatment options, medications, injectable therapies, as well as prosthetic surgery. Treatment options for erectile dysfunction include diet and lifestyle changes, oral medications, penile injections and gels, as well as more definitive treatment options such as a penile prosthesis. When patients come to see me, I like to discuss all available treatment options for erectile dysfunction, as well as what that patient may have tried in the past. We'll discuss the relative risks and benefits of each of these treatment options and use a collaborative process to decide the right treatment. I'll also see my patients back frequently to assess how they're doing, and certainly we'll offer additional treatment options if they aren't at their goals. General satisfaction rates with the treatments can be divided by the type of treatment that we're offering. In general, oral medications have a roughly 50% satisfaction rate, penile injections and gels roughly a 30% satisfaction rate, and more curative options such as a penile implant have 90 to 95% patient satisfaction rates. Like most parts of the body, if we are not regularly sending blood supply to this area, the body's natural response is to create fibrosis and scar tissue. So therefore, long-term consequences of not having erections may include worsening erectile dysfunction, penile scarring and curvature, as well as shortening of the penis.